So from the X-ray, I focus on right here at one of the septal joint at the talonavicula. It's kind of narrowing, and there's some kind of exostosis on the medial side and the lateral side. If I expand it, there's some exostosis, right? And joint space narrowing is not even because it's wider on the lateral and it's narrower on the medial side. It means that you have some sort of arthritic change already. And then this one, it's a little bit more obvious that you have arthritic change, joint narrowing on the outside and wider on the inside.
It should be equal from here to
Yes.
here, right? So it's the balance is just gone.
Right.
Okay.
And then there's some exostosis right here and right there. And the last one with the lateral view. So the septal joint right here is quite okay. There's some sort of like beginning of the arthritic change, but right here, talonavicula and CCJ or calcaneocuboidal joint, it's kind of arthritic change. So all of this overall, I would say that you have PTTD or posterior tibial tendon dysfunction. It has a stage. It has a stage 1, 2A, 2B, 3, and 4. At this point, I would say that you might have at least 2B.
Not the third, not the
Not
three, right?
possibly the third one. I have to check first with the all of the physical exam, and the last one you have defects on the ankle joint as well, which is the worst one. But even though like with the stage 2B or 3, the recommended surgical procedure will be fuse all of this joint. So not only that joint has to be fused. As you can see right here, the orientation of this bone is not in the same alignment with that bone. So one of the correction has to be put this bone down.
Yeah.
So overall foot appearance will be better.
You mean after operation?
During
any surgery?
During the surgery. So not only fusion of the joint right here, it also has to do something right here because you have bunion. And as you can see, you have like a big callus on the medial side of the big toes. So the way that you walk right now, you put too much weight on that side. And with the collapse of the arch. So if we correct this area, we have to check again with all alignment. And then after we check alignment right here, if the alignment of the first metatarsal and this bone in the same line, about the same line, you get some arch. That will be it.
So how long it's gonna take from me? I mean, after surgery, how long can I walk or run and?
So it depends. It depends on the surgeon. So if I do it my way, means that after fusing, I will use part of your blood as well. I will use about like 27 cc of your blood, centrifuged, spin it down, and correct just only the important part. Mix with the bone that we have to put in right here, just to promote healing.
It can be done.
Yes.
I mean, by my own blood.
Yes.
Wow.
So everybody has PRP.
That's so-called PRP.
Yes.
See.
Protein-rich plasma. Things like that. So mix it and put it back right there to promote healing when we fuse the bone. So the timeline of mine after we do the surgery, right? You'll be in the cast. Or like a huge camp walker and not putting any weight for about 2 weeks.
I have to go somewhere between August to September. I have to be abroad. So
I'm not recommended to do any procedure right now yet.
Okay, so we have to
Delayed
keep it in
Yes.
the new kind of shoes, right?
Yes.
Okay.
So that's the first stage. Non-weight bearing on the affected foot. for on the surgical foot for 2 weeks, and then when I remove the staples or the sutures,
You mean you have to keep the nails? I mean the screw in
nail
in the
and
bone?
screw will be inside. The implants,
I
the
see.
implants will be inside, but the suture that I close the skin will be removed at the second week.
So
And then I will evaluate that are you okay or ready to put some weight
I see.
within the camp walker or the boot, big boot, like a
I
cast
see,
that
like
you can
like
put.
RoboCop style.
Yes, things like that,
Okay,
yeah.
so it means like I should not go anywhere. So do I
Not
have to
yet.
be hospitalized?
No.
Okay,
So
that sounds good.
most of the time I did a surgery, like an ambulatory surgery.
Yeah.
Means that you don't have to stay at the hospital. You will get heavy duty pain medications to take after the surgery. It's very important that the first 3 days. It's kind of huge procedure for the foot because it's the main joint of the foot.
Okay.
So you take that at least 3 to 5 days for pain medications, pain control, and swelling control. And then you follow up for the first time after the surgery at the first week. Clean up everything, look at for any infections, skin infections, things like that. If none, you still have to put back into the cam walker. And then the second week you come back here, I remove all of the stitches and then evaluate that you're ready to put some weight or not. It depends on how much pain you have
Okay.
and how brave you are.
Okay. So this means that I still have time to think about or
Yes.
have decision making.
Yes.
So how long it would take? Like 6 months or a year or 2
A year.
years?
A year.
Thank you. So
Because-
from now, I my foot have to be on
Shoes.
your care. Thank you.
Yes.
Okay, thank you very much.
เพราะว่า
Very understand.
ผมเคยมีคนไข้แบบเนี้ยครับ
จับไง
แบบนี้เลย
แล้วเดินได้ปะ
เขาทำไปข้างหนึ่งพอ3 เดือนเสร็จปุ๊บเขากลับไนจีเรีย
อ่าฮะ
แล้วก็1 ปีถัดมาพาให้หน่อยอีกข้างหนึ่งเสร็จแล้ว
โอเคถ้าอย่างนั้นก็ขอเวลาปีหนึ่งในการ adjust เท้าก่อนเนาะ
ค
ข
รั
อ
บบ
คุณมากค่ะ
ได้
อา
ครั
จาร
บ
ย์ขอบคุณมาก
ยินดีครับ
อาจารย์ชื่ออะไรอาจารย์ชื่อ
My name is Dr. Pubasit Clinical
โอเคค่ะ อาจารย์ชื่อภูวสิทธิ์นะคะ
ครับ
ขอบคุณมากค่ะ